Seniors. PSA myths. Most men still believe what's true today. For years, many men have heard mixed messages about PSA tests. Some say these tests save lives, while others believe they lead to unnecessary fear. This confusion often makes it hard to know what's best for your health. PSA, which stands for prostate-specific antigen, is a simple blood test, but the meaning behind the numbers is not always simple. Today, we're going to talk honestly and clearly about what PSA really means, why some myths linger, and what the latest understanding tells us. If you want more senior-friendly guides and daily wellness checklists, you can always visit theviditrack.com to find practical, trusted information. 1. PSA always means prostate cancer. One of the biggest myths is that a high PSA level always means prostate cancer. That is not true. PSA is a protein made by the prostate gland, and its level in the blood can rise for several reasons. Aging itself can increase PSA levels. Conditions like prostate enlargement, infections, or inflammation can also cause a rise. This is why doctors do not rely on PSA alone to make a diagnosis. Instead, they look at your overall health, symptoms, and other test results. This helps avoid unnecessary panic or overtreatment. Many men feel anxious when they first hear that their PSA is elevated, but a number on a lab result is just a clue, not a sentence. The goal of PSA testing is to give your doctor a clearer picture, not to create fear. What matters most is follow-up. Sometimes, a repeat test after a few weeks gives a much clearer result. In other cases, doctors may do a physical exam or imaging to see what's really going on. The right next step depends on each individual's health history. The truth is simple. An elevated PSA does not automatically mean cancer. It's a sign to check carefully, not a reason to panic. 2. Only older men should care about PSA. Another common misunderstanding is that PSA is only relevant for men well into their late 70s or 80s. While age is a factor, PSA can be a useful tool earlier too. Many doctors now encourage men in their 50s and 60s to discuss PSA testing with their healthcare provider. Early discussions can help set a baseline. When your doctor knows your normal PSA range, even small changes over time can be spotted early. This is especially important for men who have a family history of prostate cancer. If your father, brother, or uncle has had prostate issues, your own risk may be higher. Having a baseline earlier allows for smarter decisions later. It is also useful for men with other health conditions like high blood pressure or diabetes, since overall health can influence prostate wellness. George, a 62-year-old retired teacher, once believed PSA was only for very old men. But after a routine check, his doctor noticed a small but steady increase over 2 years. Further checks showed a harmless but treatable prostate condition. George was relieved and thankful he caught it early. Stories like his show why PSA matters at more than one age. 3. PSA testing always leads to unnecessary treatment. Some men avoid PSA testing because they worry it will lead straight to surgery or radiation. This fear is understandable, but outdated. Today, medical professionals use a much more balanced approach. A PSA test is just one piece of the puzzle. If a level is slightly elevated, the first step is often observation and follow-up rather than immediate treatment. Doctors may recommend repeating the test after some time to see if it stays the same or changes. Many mild increases are temporary, often related to infections or prostate inflammation that clear up on their own. If further testing is needed, it helps guide decisions carefully rather than rushing into procedures. Modern guidelines emphasize shared decision-making. That means you and your doctor talk openly about risks, benefits, and options. No one is pushed into treatment they don't need. For many men, especially seniors, active surveillance or gentle interventions work just as well. This approach reduces fear and unnecessary side effects while keeping health closely monitored. PSA testing is not a trap. It's a tool that helps make better choices at the right time. 4. A low PSA means everything is fine. It's a comforting thought to believe that a low PSA number guarantees prostate health. But the truth is more complex. PSA levels can be normal even when small prostate problems exist. In some men, certain types of prostate cancer grow slowly and do not raise PSA levels right away. This is why doctors always consider more than just one number. A thorough medical evaluation includes your personal risk factors, family history, symptoms, and age. For example, if you experience trouble urinating, pain, or frequent nighttime trips to the bathroom, it's important to talk to your doctor, even if your PSA seems normal. PSA is an important clue, but not a complete story. Regular checkups and open conversations with your healthcare provider make a real difference. A low PSA should bring comfort, but not lead to ignoring your body's signals. Paying attention to small changes is one of the best ways to protect your health as you age. Joining our YouTube membership gives you access to printable senior-friendly health trackers, weekly wellness plans, and supportive community discussions to help you stay informed and confident in your health journey. 5. PSA tests are unreliable and not worth it. Many men hear stories from friends or online claims that PSA tests give false alarms or miss problems. While no test is perfect, PSA remains a valuable early signal when used wisely. Its strength is in showing trends over time, not just single results. A one-time PSA test gives a snapshot, but repeated tests build a story. James, a 67-year-old mechanic, had his first PSA test at age 65. The result was slightly elevated, but nothing alarming. A year later, it climbed higher. His doctor ordered more tests, and they found an early-stage issue that could be treated easily. If James had ignored the test, it might have gone unnoticed for years. Instead, a simple test gave him time and options. Modern medical guidelines are better at interpreting PSA changes than in the past. This means fewer unnecessary alarms and smarter responses. When paired with experienced medical guidance, PSA testing can be a life-saving early signal. 6. PSA testing always has side effects. Some men worry that simply taking a PSA test might bring discomfort or risk. In reality, the test itself is just a blood draw, much like a cholesterol test. It takes only a few minutes and is generally safe. The concern some men have is about what happens afterward, like further testing. While follow-up procedures can sometimes involve mild discomfort, no one is forced to take the next steps without understanding the options. Today's medical practice emphasizes informed choices. If a PSA test shows something unusual, your doctor explains the next steps clearly. You can take time, ask questions, and decide what's right for you. This sense of control makes the process less stressful. It's also important to remember that early detection often leads to less invasive care. Many men who monitor their PSA regularly never need major treatment. Instead, they work with their doctors to manage their health gently and effectively over time. 7. PSA testing is not necessary after a certain age. A final myth is that men should stop thinking about PSA once they hit a certain age. The truth is more personal. Some men in their late 70s or 80s remain active, healthy, and benefit from continued monitoring. Others may have health priorities that make frequent testing less necessary. The key is individualized care. Mrs. Davis, whose husband is 78, recalls how his doctor explained that the decision isn't about a number on a calendar. It's about overall health, life goals, and comfort. For some seniors, continued PSA testing brings peace of mind. For others, it's a shared choice to step back. Neither decision is wrong. Good medical care respects your values and lifestyle. A thoughtful conversation with your doctor ensures PSA testing works for you, not the other way around. Understanding this gives seniors the power to make clear, calm, and informed choices about their health. Your health matters every day, and knowledge gives you power to make wise decisions. If you'd like more clear, senior-focused information on prostate wellness, gentle routines, and wellness tips, you can find easy guides and supportive tools at thevidatrack.com. Staying informed is one of the kindest things you can do for yourself and your loved ones. With the right information, fear turns into confidence, and health becomes something you can face with calm and clarity.